Is COVID still a threat for seniors in 2025? With new variants and changing rules, it's easy to feel confused. But don't worry today. I'll break down what's really different this year and what you can do to stay safe and enjoy life. COVID-19 has been a huge part of our lives for a few years now, hasn't it? And even though many of us hoped the pandemic would be behind us by now, the truth is COVID is still with us and it's still changing. In 2025, things look a bit different than before, especially for older adults. You might be wondering, what's new? Are the vaccines still effective? Should I still be wearing a mask? And what about these new variants I keep hearing about? If you've had these questions, you're not alone. And that's exactly what we're going to talk about today. I'll explain what's different in 2025, what that means for seniors, and what simple steps you can take to keep yourself safe and healthy. This isn't about fear. It's about being informed and feeling confident. I want to help you understand what's happening with COVID right now, so you can make the best decisions for yourself and your family. If you find this video helpful, please give it a thumbs up and consider subscribing to the channel. That way you'll never miss important health updates designed just for seniors. All right, let's get started. Let's take a closer look at where we stand with COVID-19 today, especially for seniors. It's important to understand how things have changed so you can feel more in control. Since COVID first appeared, older adults have been one of the most affected groups. That's because as we get older, our immune system naturally weakens. This makes it harder for the body to fight off infections like COVID-19. So seniors have a higher risk of getting seriously ill if they catch the virus. But the good news is we've learned a lot since those early days. Vaccines, treatments, and safety guidelines have all improved a lot. Still, the virus keeps changing, and so do the ways we protect ourselves. In 2025, we are dealing with some new variants of the virus, like the XEC variant you might have heard about. These variants can spread more quickly or sometimes behave differently than the original virus. Some might cause milder symptoms, while others could be a bit more stubborn against certain treatments or vaccines. Because of these changes, it's important that the safety advice for seniors changes too. Early on, many places had strict rules like lockdowns, mask mandates, and social distancing to stop the spread. Now, many of those rules are relaxed or gone, but the risk hasn't disappeared, especially for older adults. Vaccines remain one of our best defenses. The COVID vaccines have helped millions avoid severe illness, hospitalization, and even death. But because of new variants, the vaccine shots themselves have also changed. In 2025, health experts recommend updated booster shots that are designed to protect better against the newer variants. If you haven't gotten your booster recently, it's a good idea to talk with your doctor about whether you should get the updated shot. These boosters help keep your protection strong over time. Besides vaccines, other habits are still helpful. Washing your hands regularly with soap, wearing a mask in crowded or indoor places, and staying away from people who are sick can all lower your chance of catching the virus. But what if you do get sick? That's where new treatments come in. Doctors now have better medicines called antivirals that can be taken early on to help reduce the severity of COVID. These medicines can make a big difference, especially for seniors or those with other health issues. Finally, let's not forget mental health. The isolation and changes during the pandemic have been tough, especially for seniors who might already feel lonely. Staying connected with friends and family, even if it's just a phone call or video chat, is important for keeping spirits up and staying healthy. So as you can see, while COVID is still around and still a concern, especially for seniors, we have many new tools and better knowledge to help keep you safe in 2025. Now that we understand what's happening with COVID in 2025, you might be wondering, why should I really care about these changes? What difference does it make for me as a senior or for someone I care about? The answer is simple. Staying informed and aware means staying safer and more confident in your daily life. COVID isn't just about avoiding illness. It's about protecting your quality of life, your independence, and your peace of mind. When you know what's new and what works best, you can make choices that keep you healthier. That means less worry about getting seriously sick and more time enjoying the things that bring you joy. For example, understanding the importance of the latest booster shots can dramatically lower your risk of hospitalization or severe symptoms. When you get that updated vaccine, you're giving your immune system the best chance to fight off the new variants. It also means knowing when and where to wear a mask which might still be a good idea in crowded indoor spaces or during times when cases are rising. This way you can confidently attend social gatherings or run errands without feeling unsure or scared. Another important part is being aware of early treatment options. If you do catch COVID, taking antiviral medications early can reduce how sick you get and help you recover faster. That knowledge alone can be empowering, helping you act quickly and get the right care. Mental health is equally important. The pandemic has shown us how isolating times of crisis can be, especially for seniors. But staying socially connected, whether by phone video calls or safe visits, helps keep loneliness away and boosts your overall well-being. Many seniors have told me that learning about these updates and taking small, manageable steps has helped them feel more in control and less anxious. That's the power of knowledge. It turns uncertainty into confidence. So by paying attention to what's different in 2025, you're not just reacting to changes, you're taking charge of your health and your life. And that's something truly worth caring about. Now that we've talked about what's different in 2025 and why it matters to you, let's focus on some simple steps you can take today to stay safe and healthy. These actions will help protect you, your loved ones, and allow you to keep enjoying the life you love. 1. Talk to your healthcare provider about boosters. One of the most important things you can do is ask your doctor about getting the latest COVID booster shot. These updated boosters are designed to protect you better against the new variants circulating this year. Even if you've been fully vaccinated, before staying up to date with boosters helps keep your immune system strong. If you're unsure whether you need one, don't hesitate to ask your healthcare provider for personalized advice. Have you had your booster shot recently? Feel free to share your experience with us. 2. Practice good hand hygiene. Washing your hands regularly with soap and water remains one of the easiest and most effective ways to avoid catching many viruses, including COVID. Try to wash your hands after being in public places, before eating, and after coughing or sneezing. If soap and water aren't available, use hand sanitizer with at least 60% alcohol. How often do you usually wash your hands during the day? Do you have any tips to help remember? 3. Use masks. When appropriate, masks might not be required everywhere anymore, but wearing one in crowded indoor spaces, on public transportation, or around people who might be sick can greatly reduce your risk. Choose a well-fitting mask that covers your nose and mouth. It's perfectly okay to politely ask others to wear masks or keep some distance if it makes you feel more comfortable. How do you feel about wearing masks in 2025? Share your thoughts below. 4. Monitor your health daily. Pay attention to any new symptoms like cough, fever, fatigue, or difficulty breathing. If you start feeling unwell, get tested for COVID and contact your healthcare provider promptly. Early diagnosis means you can get the right treatment sooner, which is especially important for seniors or people with other medical conditions. Do you regularly check your health or monitor symptoms? What has your experience been like? 5. Stay informed from trusted sources. There's a lot of information out there, and not all of it is accurate. Make sure to follow trusted organizations like the Centers for Disease Control and Prevention, CDC, your local health department, or your doctor for the latest COVID updates and recommendations. Avoid spreading misinformation by double-checking facts before sharing. Where do you usually get your health news? Can you recommend any reliable sources for everyone? 6. Stay socially connected. Protecting your physical health is vital, but don't forget your emotional well-being. Stay in touch with family and friends through phone calls, video chats, or safe in-person visits. Staying connected can help reduce feelings of loneliness and boost your mood. Who do you stay connected with most? What ways do you find helpful to keep in touch these days? 7. Consider your environment. Keep an eye on COVID case numbers in your area. If cases are rising, try to limit unnecessary outings or opt for safer options like online shopping or having someone you trust help with errands. Being flexible with your plans helps reduce exposure risk. Do you have a plan for how you'll handle things if COVID cases rise in your community? 8. Have a plan for treatment. If you test positive for COVID, it's important to act quickly. Ask your doctor about antiviral medications that can help reduce the severity of illness. Having a plan in place means you can get care right away, improving your chances of a mild recovery. Are you aware of current COVID treatments? Would you feel comfortable asking your doctor about these options if needed? Remember, every person's situation is different. Some seniors might feel comfortable being more active, while others might need to take extra precautions. The key is to listen to your body, stay informed, and make decisions that feel right for you. Thank you so much for watching and taking the time to learn about COVID safety for seniors in 2025. If this video helped you, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to the channel for more health updates tailored just for you. Stay safe, stay informed, and remember, you have the power to protect your health and enjoy life in 2025 and beyond. See you next time.